Thank you, President Mandel. I appreciate it, and I'm delighted to be here amongst all of you and for President Mandel's first baccalaureate, my first baccalaureate, and your first baccalaureate. So we'll get through this together. So I really just wanted to say thank you for inviting me to be here with you during this reflective and important time, the eve of your commencement. I hope this pause before all the horn blowing tomorrow allows you to take stock and meditate a little on what you've achieved. Are you able to pause? I mean, I know you haven't paused this week. That's clear. This has been an important non-pausing week for you. But I hope so, because I've heard a little bit about the din and the fray that has characterized these last 4 years here and in our country. A seemingly relentless and challenging time that you're ready to conclude, and not just academically. It's certainly been a complex time, fragile gains being undone, protections for vulnerable populations vanishing, and our own truths challenged. It has also been, I hope, a fruitful time for all of you, and a nourishing one. The friendships that you have made and the community that you've built here can last all your life. And I've heard that your time here has been important for the school, that your efforts to make Williams the best and most inclusive place have catalyzed work which will endure long beyond your years here. A gift to the students who will follow you and to their teachers too. And speaking of gifts, I hear that the board considered a motion to update the name of the school to Will I Am. It didn't carry this time. But Michael Rubel and his undercover team, sowing fun and perhaps mischief, sound like just the sort of folks I'd like to hang out with later. I hope that you will carry with you onward into your lives beyond Williamstown the fierce energy of your collective, the spirit that saved and reinvigorated the JA system and also gave rise to waffles. You'll take with you some of the answers you found here, and you should plan to hang on to some of the questions too. I suspect that some of the questions uppermost for you all right now might include variants of what now, what next, and perhaps the notion that the right answer, the just right answer, or the one true answer is essential and will light a path. I have bad news. There isn't one right path, and better news. There isn't just one right path. Your life to date, your college career, the sum of your work, and your knowledge is irreducible. You do not need to have a plan right now for the rest of your life. You will have to choose and keep choosing. Our lives are a series of small things put together, not 2 or 3 big things. And I did not know this when I graduated from college. My sense after speaking with one engaging student in particular is that you all have taken to heart your liberal arts education. You have not narrowed, and instead have paired your majors. Your concentrations speak to that. Geoscience and studio art as a double major, or chemistry and English, math and Chinese. Or in the words of this student that I spoke with, and I'm going to quote her because it's lovely, people pursue their passions here, in the classroom, but also outside of it. It's a tough academic environment because people expect a lot of themselves and work really hard. But it's also an incredibly collaborative environment. I think the professors and other students are really committed to helping with that learning process and pursuit of passions. This bodes well for all of you, that you already have such a good grip on the notion of a wide field of vision. Many people don't, especially as they get older. Students often ask me what choices I made to set me on a road to a career in global health. Something along the lines of physics followed by pre-med, then an internship at a humanitarian organization perhaps, would have been an obvious course. But the truth is, I bushwhacked the whole way. I just want to take a little pressure off you because I had no clear idea of where I would go, nor how I would get there. In fact, in the true words of a lovely colleague, you only know about your journey in hindsight. And when I first went to Haiti, 36 years ago, I was 18, don't do the math, and volunteering for an eye care organization. I wanted to get some experience beyond my lovely but limited world in rural England. And the idea was that some time spent away would help me figure out what I wanted to do with my life, or, I have to confess, to buy me some time. When I arrived, the country was in its third decade of a brutal dictatorship. Baby Doc Duvalier ruled the country by fiat and violently suppressed any opposition. He had no interest in representing the majority of the population, who lived on far less than $1 a day, dying of vaccine-preventable diseases and feeding their children cakes made of mud and water to fill their empty bellies. It was a jarring awakening, coming face to face with the terrible conditions in which millions of people were forced to live, and with so much preventable suffering and death just an hour's flight from Miami. I realized early on that it would be impossible for me to go back to my life as it had been and forget what I had seen and those I had met. Among them, Paul Farmer, the young doctor-to-be who would become my lifelong friend and partner. We banded together to try to address a small piece of the astounding levels of illness and suffering we saw before us. Guided by our Haitian partners, we tried to bring the fruits of modern medicine to an area where there was none, and knew early on that we would need to focus on the slow work of building systems rather than providing first aid. As we were getting to know each other and Haiti, we were aware that we knew almost nothing about the socio-political history of the region. We read all that we could get our hands on and came to understand that Haiti, the first free black republic and once the most prosperous country in the world, in the Western Hemisphere, was now the poorest. We were learning about the structural mechanisms behind its impoverishment and found the fingerprints of Western governments, our own chief among them, on every surface we examined. We didn't have to search too hard for evidence of structural violence in the small community where we were working, Cange, in Haiti's Central Plateau. There, the subsistence farmers had lost their land to a massive hydroelectric dam project in the 1950s. The project had been funded by US companies and US-backed development agencies who profited from it. The farmers that the project displaced had never been compensated and had never fully recovered. And so, bereft of their land and their means of survival, their health and prospects had been sharply diminished. It was the beginning of an awakening for me, one that continues to this day, becoming alive to the deep connections between the policies of powerful countries and the bodies and the lives of the poor, even continents away. So I was compelled by this obvious and gross injustice and committed with others to addressing it. By the way, anything difficult that you do should be done with other people, preferably those you trust and love. And at this point, I grappled with the decision of whether to go to medical school, anxious that if I didn't become a doctor, I wouldn't be able to provide the care that was so critically needed, and that I'd be a less effective advocate. Eventually, because of an excellent liberal arts education at another college, beginning with W, I realized that I didn't have to become a physician to help deliver on the human right to healthcare, and that addressing the underlying causes of poverty and ill health is work that calls on all of us and on every discipline. I also realized that wrestling with what one should do instead of what one loved to do is as old, as well, older than Methuselah, much. That choice, not to go to medical school, took me out of the lab and into a survey class in English literature, where I was exposed to a piece of writing that I still return to often, a Milton sonnet, whose arresting first line is, "When I consider how my light is spent." In it, Milton limns his choices in the face of his onrushing blindness. He had set aside his work as a poet in order to write political articles and pamphlets for a cause he felt strongly about, fighting for liberty on the side of Oliver Cromwell and against the tyrant of his time, King Charles I. As he started to lose his sight as a young man, before even, in his words, half my days, he questioned this choice. He asks in his sonnet how best to use the life that's left to him. And it's a question I ask myself all the time as the choices, big and small, present themselves each day. And my days, ever since that first trip as a teenager, have included thoughts of Haiti, time spent there, and the ongoing work to address the systemic, generational starvation of a country, a people, and its systems. And although my path has meandered through different fields, schools, and continents, with some really excellent detours along the way, please don't deny yourselves the pleasures of a few wrong turns and dead ends. But again and again, I have returned to Haiti, one of my earliest and best teachers. In 2010, when I think many of you were roughly 13, Toy Story 3 was out in theaters. The Red Sox were in a bit of a slump. I was in Boston when a 7.0 earthquake struck just outside Haiti's capital of Port-au-Prince. Over 200,000 people were killed, and 1.5 million left homeless. It was absolutely devastating. PH's team and facilities out in the center of the country were largely spared, but many of our colleagues' family members were not. Our Haitian co-workers lost more than 500 loved ones. It was a terrible time, and it was also a time when people came together in extraordinary ways. Over half of American households donated to the relief effort. Half of American households to that relief effort. Hundreds of people turned up at the PH office to help. A host of former co-workers put their professional lives on hold, drove from far reaches, willing to do any task, volunteer, take a leave from med school. We had engineers, electricians, surgeons, nurses, anesthesiologists, restaurant owners, and pilots who all came together. And on top of the expertise, there was also a constant supply of goodwill and generosity. Beneath my exhaustion and sadness and my relief and gratitude lay the knowledge that what happened in Haiti was an unnatural disaster, that the same forces which have conspired to weaken and impoverish the country made it unnaturally vulnerable. And in the midst of this, about 2 or 3 weeks after the earthquake, I was invited by Speaker Nancy Pelosi to be one of her guests at the State of the Union address. It was the first time that I had gone there. As I drove from Dulles Airport towards the Capitol, threading through Washington's tall monuments and massive federal buildings, it was hard to reconcile the capital city I just left, Port-au-Prince, with this one. Nearly all of Haiti's federal buildings had been destroyed in the quake. The National Palace collapsed. The city was choked with tents and makeshift dwellings, rubble, bodies, buckled roads and crumbled houses, people still being unearthed, and everyone shell-shocked and braced for aftershocks. I reached the Speaker's office, and a group of us walked together with an aide along a labyrinthine route of narrow back passages, down staircases not meant for the public. And it was then I saw dozens of men crouching in full military gear with hoods lining the stairs and along the corridors every 10 feet, backpacks and breathing gear at the ready. The security had been really tight to get admitted anywhere near the perimeter of the Capitol, and I wondered why all these good and brave people, trained responders, equipped to the nines, were here where there was no crisis, instead of in Haiti, where there was a massive one. I also wondered how different it might be if, heaven forfend, an earthquake of that magnitude were to strike in the US. I didn't have to wonder too long, because 3 months later, and 3,000 miles from Haiti, I was with my mother in her hospital room in Los Angeles. She had been diagnosed with lung cancer 3 weeks after the earthquake in Haiti. And in the early evening, I sat in her comfortable room on the 14th floor of Cedars-Sinai Hospital, where, aged 84, she was contemplating her treatment options. She was also contemplating the Jell-O on her plate. What is it about hospitals and Jell-O? Then, without warning, the room began to sway. Some of you might have experienced this, but it is such a disturbing feeling, the disordered movements of a building in an earthquake. Things tumbled from the little bedside table, and I ran to the nurse's station, trying to suppress my panic, and asked what was happening. The busy nurse barely looked up and said, "It's an earthquake, hon. Don't worry. The hospital's built on rollers." She kept on with her charting, and she added, "You can put your mum's stuff on the floor if it's falling off her table." Her casual assurance was so striking. I realized that I had left a country where an earthquake had literally destroyed a whole city and many people in it. I flashed back to the pancaked buildings, the ruins of hospitals and schools, teachers and students forever trapped inside, the crazed roads, cracked air traffic control tower, the damage and the chaos and the awful, awful human losses. Now I was standing in a huge hospital on the 14th floor as it gently rolled through an earthquake of similar magnitude. A few tissues jumped off tables, but the nurse's work was not even disrupted. It grieved me to think how different things might have been in Haiti had different systems been in place, building codes enforced, better care available for the injured. And as I looked across the room at my mother approaching the end of her life with resolve and dignity and the very best care available, I was so grateful both that these resources were available to and for her, and that I get to work every day with a team committed to making them available for everyone. As the world continues to spin and shake, how can we make sure that everyone has access to the kind of systems that converted an earthquake from a shattering catastrophe into the engineering marvel of a non-event? How can we make sure that all systems beyond healthcare, like criminal justice, environmental and educational systems, serve everyone, and in doing so, aspire to the highest possible standards? Our work is very much the work of a big, broad team and of a lifetime of small choices and big ones, day by day and year over year. It spans fields and disciplines. I know many of you have taken it up during your time here. I know you will continue. So as we are called to do in this baccalaureate service, let us offer gratitude for all that you've learned here, and to those that have taught you well, your marvelous faculty, this place itself, and your peers perhaps above all. Let us give thanks for the opportunity to serve and the many, so many means by which we might do so. I ask you to spend your light, and it is a beautiful light indeed. Just look at all of you, that nearly graduated glow. I exhort you to spend your light where it might shine brightest. Let it illuminate the corners where iniquity and injustice collect. Let it be a beacon to those most in need of one. Let it bring you joy. Congratulations, William graduates to be, and congratulations to your family, to those who've loved you and lifted you up, who've lit your way. Thank you so much.